The Affordable Health Care Act requires that every state have a health care exchange, which is some kind of a portal, some kind of a mechanism by which insurance policies are provided. And people that would be interested in those policies can actually go to this exchange and be able to select policies that would meet their health care needs. And then people that qualify under the Affordable Health Care Act to receive federal assistance for individuals or for their families, they will take federal vouchers, money, and go into the exchange and use those vouchers to purchase insurance for themselves, for their families. And so what happened with this is, recognizing that the law said you have to have an exchange, the governor set up a commission that was the Alabama Health Exchange Commission, and the two chairs, co-chairs of that, were myself and then Representative Jim McClendon, who's the chairman of the Health Committee in the Alabama House of Representatives. We moved through a 3-month process with 15 members of the commission that represented all the different stakeholders in the health exchange topic question, stakeholders in healthcare in general in Alabama. And we basically put together, with consultants that were hired by the state and some folks that the governor had appointed to be able to work on this commission. We went back to the governor on December the 20th of last year with a report. And then since that time, there's been continued discussion about what are we going to do with the exchange, what's the future of the exchange, and basically that commission had outlined in those suggestions back to the governor how the exchange could be set up. And so what we have now is a piece of legislation sponsored by Representative Greg Wren in the House that I think is probably going to come up for a vote. They've had 2 public hearings on it, and it basically is just a framework of what an exchange would be. One of the requirements of the federal law is that before 2014, you must have an exchange that is enacted.
Each state must have an exchange.
Each state must have that. If you do not, then the federal government will come in, take over the exchange process, create one for you, and force you into a place to where you have to function under what they deem as what you're supposed to have as the exchange. So I think overall the theme here is, number one, we wanted to be proactive. Number 2, we want to wait and see, if we can, what's happening at the federal level from the standpoint of what's going to be the Supreme Court ruling. And then we want to be prepared as leaders in Alabama that if the exchange is a must, then we have a basic framework that will allow us to move forward and be able to meet the basic requirements of the law in being able to provide what's required.
Okay, good. So we're prepared no matter what happens.
As long as we move forward with this legislation, it would give us that level of preparation. And there'll be a lot of discussion related to it. You know, who's on the board of the exchange and those kinds of things. There'll be different discussions. There's been quite a bit in the 2 public hearings that were held in regards to that. But I think it will continue to be an interesting idea as we learn what's going to happen at the Supreme Court level. One of the things that we see in the legislation is that if the legislation passes before we leave session, and if the bill is declared unconstitutional, then the Alabama law would be void. And,
as would every other states, I would imagine.
That's true.
But y'all have done your work.
We've done our work, and I think we're now in a mode of trying to finalize the preparedness and then anxious to see and understand what's happening at the federal level.